Welcome at our superfood channel for cats. Today we will investigate diabetes in cats. My name is Rob. I am author of dozens of pet books sold in more than 25 countries. If you have any questions or remarks or additions, leave a comment and I will respond. Did you know that cats can also suffer from diabetes just like humans? This condition is known as feline diabetes, or cat diabetes for short. It's a chronic disease that affects a growing number of our feline companions globally. Now you may be wondering, how does this happen? Well, just like in humans, feline diabetes occurs when a cat's body either doesn't produce enough insulin or becomes resistant to it. Insulin is a hormone that helps regulate blood sugar levels. When there's a lack of it or the body can't use it effectively, blood sugar levels can rise, leading to diabetes. The result? A host of health complications that can significantly impact a cat's quality of life. But fear not, with the right knowledge, you can manage this condition effectively. Understanding the causes, symptoms, treatment options, and care tips for cats with diabetes is crucial for managing the condition effectively. The products shown in this video are pure for illustrational purposes and no recommendations, nor are we getting sponsored or paid otherwise. So what causes diabetes in our feline friends? This is a question that many cat lovers grapple with, and while the exact cause isn't entirely known, several factors are believed to contribute to its development. First up, we have obesity. Overweight and obese cats are at a higher risk of developing diabetes. This is because excess weight puts a strain on the body, increasing the demand for insulin production and lowering the body's sensitivity to insulin. It's similar to what happens in humans. More fat cells mean more resistance to insulin, which can eventually lead to diabetes. Age is another significant factor. As cats age, their risk of developing diabetes increases. Most commonly, we see this condition in cats over the age of 7. So while age isn't a cause per se, it's a crucial risk factor to keep in mind. Then there's the genetic component. Certain cat breeds might have a higher predisposition to diabetes. For instance, Burmese and Siamese cats are often more susceptible to this condition. While not all cats of these breeds will develop diabetes, their genetic makeup can make them more prone to it. Last but certainly not least, we have other health conditions. Diseases such as pancreatitis and hypothyroidism can increase a cat's risk of developing diabetes. These conditions can interfere with the cat's normal insulin production or the body's ability to use insulin effectively, paving the way for diabetes. It's important to remember that these are just potential causes and risk factors. Each cat is unique, and what triggers diabetes in one cat may not in another. That's why regular vet checkups and a keen eye for changes in your cat's behavior are so important. They can help detect any issues early and provide the best possible care for your feline friend. While the exact cause of diabetes in cats is not fully known, these factors can significantly increase the risk. So, stay informed, stay observant, and remember, early detection can make a world of difference for a cat with diabetes. How can you tell if your cat might have diabetes? Well, there are several symptoms to watch out for. The signs may vary from one feline to another, but there are common indicators that suggest your cat might be grappling with this condition. One of the earliest and most common signs of feline diabetes is increased thirst. Cats with diabetes often drink more water than usual, leading to more frequent urination. If you notice your cat making more trips to the water bowl or litter box, it might be a sign of diabetes. Another symptom is weight loss, even when your cat seems to be eating normally or even more than usual. This happens because without enough insulin, your cat's body starts burning fat and muscle for energy. So despite a normal or increased appetite, weight loss could be a sign of diabetes. Speaking of appetite, another symptom of diabetes in cats is an increased appetite known as polyphagia. Cats with diabetes may act like they are always hungry because their bodies can't use the glucose in their blood for energy. So even though they're eating more, they might not gain weight. Lethargy and weakness are also signs of feline diabetes. Cats with this condition may sleep more than usual and show less interest in activities they once enjoyed. They might also exhibit general weakness, particularly in their hind legs. Dehydration, urinary tract infections, and vomiting are other symptoms to watch out for. And in some cases, cats with diabetes may display changes in their gait or posture due to a condition known as diabetic neuropathy, a form of nerve damage caused by prolonged high blood sugar levels. Early detection is key, so being aware of these symptoms can help catch the condition early and start treatment promptly. If you notice any of these signs, it's crucial to consult with a veterinarian. Remember, these symptoms are not exclusive to diabetes and could indicate other health issues, so it's always best to seek professional advice. Diagnosing and treating feline diabetes involves a combination of clinical observations and medical interventions. To diagnose diabetes in our feline friends, veterinarians rely on a combination of clinical signs such as increased thirst and urination, weight loss and lethargy, along with physical examination findings. They also conduct blood tests, specifically looking at blood glucose levels, and analyze urine samples. Once a diagnosis is confirmed, the treatment typically kicks in. The cornerstone of feline diabetes treatment is insulin therapy. Just like in humans, most cats with diabetes require insulin injections to regulate their blood sugar levels. The type of insulin, its dosage, and the schedule of injections are carefully determined by the vet, taking into account the individual needs of your cat. Diet also plays a pivotal role in managing diabetes in cats. A balanced, high-protein, low-carbohydrate diet is essential. Specialized diabetic cat foods or homemade diets may be recommended by your vet to ensure your cat gets the right nutrition. Maintaining a healthy weight is equally important, especially if obesity was a contributing factor to the onset of diabetes. Weight loss through diet adjustments and exercise can significantly improve insulin sensitivity in cats. Monitoring is yet another crucial part of the treatment plan. Regular checkups of blood glucose levels, weight, appetite, water intake, and overall health help assess your cat's response to treatment. Any changes can then be addressed promptly, and necessary adjustments can be made to the treatment regimen. Remember, managing feline diabetes is not a one-time task, but a long-term commitment. It requires consistent care, patience, and understanding. But with the right treatment, regular monitoring, and a healthy lifestyle, your cat can continue to enjoy a good quality of life. With appropriate treatment and monitoring, a cat with diabetes can lead a normal and happy life. So don't lose heart if your cat is diagnosed with diabetes. Instead, embrace the challenge and provide your furry friend with the best care possible. After all, they depend on us for their well-being, just as we depend on them for their unconditional love and companionship. Managing a cat with diabetes requires a consistent routine and careful observation. It's about being attuned to your feline friend's needs and adapting to them. Let's delve into some care tips that can help you in this journey. First and foremost, establish a routine. Cats are creatures of habit, and this couldn't be more crucial when dealing with diabetes. Consistent feeding times, insulin injections, and monitoring can help regulate your cat's blood sugar levels. Remember, consistency is key. Next, keep a vigilant eye on your cat's symptoms. Any changes in behavior, appetite, water intake, or even litter box habits could indicate fluctuations in blood sugar levels or other underlying health issues. It's all about staying one step ahead and catching any changes early on. Administering medication properly is another vital part of managing feline diabetes. Learning how to give insulin injections correctly and safely is critical. Always follow your veterinarian's instructions, rotate injection sites, and watch out for signs of hypoglycemia, which is low blood sugar. Preventing obesity is also a significant part of the puzzle. A healthy weight can go a long way in managing diabetes in cats. Portion control, regular exercise, and a balanced diet can help your cat maintain a healthy weight. Remember, every pound counts. Lastly, never underestimate the importance of regular veterinary checkups. These visits allow your vet to monitor your cat's condition, assess the effectiveness of treatment, and address any concerns in a timely manner. In essence, managing a cat with diabetes is a balance of routine observation, proper medication administration, weight management, and regular veterinary care. It might seem daunting, but with a little patience and a lot of love, it's entirely doable. Remember, your love and care can make a big difference in the life of a cat with diabetes. In conclusion, feline diabetes is a serious but manageable condition. The journey begins with understanding the causes, from obesity to age and genetics. Next, recognizing the symptoms such as increased thirst, appetite, or unusual lethargy. Diagnosis follows, leading to treatments like insulin therapy and dietary changes. But remember, care doesn't stop there. Regular monitoring, proper medication administration, weight management, and routine vet checkups are key. With the right knowledge and resources, you can help your cat live a healthy and happy life despite diabetes. If you found this video helpful or interesting, show some appreciation by hitting the like button and subscribing for more. This helps us a lot so we can make more informative videos about cats. We are working on a group of channels around superfood and health in pets and animals. The first 3 channels are about horses, rabbits, and this channel about cats. There are already hundreds of interesting videos. We will be creating more. You can find the links in the description below. We hope to see you there.